Hello everyone. Today, we're diving into the world of a medication called Pirtobrutinib, commonly known by its brand name, Jaypirca. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Pirtobrutinib, marketed under the brand name Jaypirca, is an oral tablet that falls under the category of Bruton's tyrosine kinase (BTK) inhibitors. This medication primarily targets and inhibits the BTK protein, which plays a crucial role in the growth and survival of B cells. By inhibiting BTK, Jaypirca can help manage and treat certain types of B-cell malignancies. Approved by the FDA, it's commonly prescribed for adults with mantle cell lymphoma, MCL, who have received at least one prior therapy. Jaypirca is also being studied for its potential use in other B-cell-related conditions and cancers, providing a promising option for patients with these challenging diagnoses. Warnings: Pirtobrutinib comes with its set of precautions. It's not intended for individuals who are allergic to any of its components. There is a potential risk for serious infections, bleeding problems, and heart rhythm issues, including atrial fibrillation and atrial flutter. Patients with a history of heart conditions should use this medication with caution. Additionally, Jaypirca may cause low blood cell counts, neutropenia, thrombocytopenia, anemia, and can increase the risk of new cancers, including skin cancer and other solid tumors. Before taking this medicine. Before starting Pirtobrutinib, several factors need consideration. It's essential to inform your healthcare provider if you have any allergies to the medication. Given its impact on the immune system and blood cells, those with pre-existing conditions such as infections, bleeding disorders, or heart problems should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider, as Pirtobrutinib may cause harm to the fetus or nursing baby. Regular monitoring of blood counts and heart function is advised for those taking this medication. You should not take Pirtobrutinib if you are on certain other medications that can interact with Jaypirca, especially blood thinners or medications affecting heart rhythm. It's also not recommended for individuals with severe liver impairment. Before starting the medication, inform your doctor if you have ever had liver problems, other types of cancer, or if you are undergoing treatment for another cancer. It's also essential to let your healthcare provider know if you have any current infections, or if you are scheduled for surgery or other medical procedures. Side effects: all medications can have side effects, and Pirtobrutinib is no exception. Some individuals might experience common side effects such as diarrhea, fatigue, muscle and joint pain, and bruising. There is also a potential for more serious side effects, including infections, bleeding problems, and heart rhythm disturbances. Additionally, there's a risk of developing second primary malignancies, including skin cancers, in patients taking Pirtobrutinib. It's important to perform regular skin checks and protect your skin from excessive sun exposure. Another potential side effect is the onset of low blood cell counts, which can increase the risk of infections and bleeding. Symptoms of low blood cell counts can include fever, chills, unusual bruising or bleeding, and fatigue. If you experience any of these symptoms, it's crucial to get medical help right away. Furthermore, Pirtobrutinib may cause serious side effects including high blood pressure, liver problems, and kidney problems. It's also important to note that Pirtobrutinib can cause severe and sometimes fatal infections. Symptoms of infection can include fever, chills, cough, shortness of breath, and flu-like symptoms. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Pirtobrutinib might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Pirtobrutinib. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of Pirtobrutinib for most adults is 200 mg taken orally once daily. It's important to take this medication at the same time each day, with or without food. If you miss a dose, take it as soon as you remember on the same day, and then return to your regular schedule. Do not take extra doses to make up for a missed dose. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: while on Pirtobrutinib, it's advisable to stay hydrated to prevent dehydration. Given the potential for dizziness and heart rhythm disturbances, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for Pirtobrutinib. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Pirtobrutinib. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.